I'll just want to take 3 minutes, as he has said, and highlight a few things. And I'm glad for the first speakers who have been here to have highlighted a number of issues that really affecting the healthcare workers, the health system as a whole. Indeed, they have touched on a number of issues, as in accordance to the WHO, we have the 6 pillars that support the health system to function. One of it is the human resource, 2 is the health financing, 3 is the health infrastructure, 4 is the leadership and governance, 5 is health information and technology, and 6 is commodity. And as you'll hear, Your Excellency, a number of these issues have already been highlighted. I think I can start from the human resource, where probably we have been projected to have understaffing, which is a big issue. A big issue because it affects accessibility. Accessibility here to mean, I come from Migori County, where I was born and raised, but I work in Nairobi. But in Migori, Kuria, in Kuria, one of the sub-county there, my father at the age of 76 have never accessed a physician. And that is a fact. And probably the healthcare workers who are there also have some limitation in terms of training, which has been mentioned here. But of course, there are very few. When there are few, means that they are denied chance to go back and do further studies. I think that is what one of my colleagues was explaining here. And the WHO has given us a good platform on what we call the staffing norm, which we project that the country, for it to attain universal health coverage, must have at least a staffing of 23 healthcare workers to 10,000 population density. Now, currently, we only have 6 counties that has attained this, Nairobi being one of it, and Kiambu, and probably one of the last one is Nakuru. The last one that I remember is Nakuru. But the issue also, even for those that have met this standard, is that there is a gap in terms of the terms of engagement. So people who have the same qualification have been engaged in different terms, and they work like they come from a different country. This should also be addressed if you take up the leadership of this government, as you address the number of the healthcare workers. And our request is, at least you focus to revamp the human resource for health. At least when you come in, 20,000 healthcare workers at once can be able to propel us next to what the WHO want. In the health infrastructure, I need to say, Your Excellency, the WHO has given a recommendation that we meet the population density. So in any case, we do not need any brick and mortar. Now, our clarion call is to focus on what we call the primary healthcare approach. In the previous, Your Excellency, there have been a congestion at the higher facility, which means in terms of resources, the funding, close to 90% of our funding are done to the higher facility. That is the level 4 and above. So the level 3, level 2, and the 1 are left to vendor, or rather to actually work doubtedly without even the people who relies on them trusting them. There is no healthcare worker there. If there is, they are not enough. There is no facility, laboratory are not functioning because there is no laboratory technologist or officer or even the reagent to ensure that they are working when they are in the hospital. And even the pharmacy, when there is drugs, there are no people to dispense these drugs. So the people who dispense drugs do not meet the requisite training, meaning that they can sometimes not dispense drug by indicating that it is out of stock, only to realize that at the end of the day that these drugs expire without being utilized. So in the sense, it speaks back to where I started, and I call that if you come in place, the focus on the primary health care is intended to activate and empower this primary health care to ensure that they can function optimally and be trusted by Kenyan. When they are trusted by Kenyan, they will seek services there and they will avoid actually bypassing them, going to the higher level, which is a high-end facility. And in any case, a treatment for malaria at a referral hospital is costly than a lower level, where probably it will be 0 rated. But if you happen to bypass by lack of trust, then means a high cost. Now, if you do that, you'll prevent diseases. 2, you'll ensure that you are promoting life. 3, you'll do early intervention. And 4, you'll ensure that you do early detection, which now leads to early intervention, meaning that cancers can be diagnosed early and be able to take intervention at an early stage. So that is our clarion call. And the last one that I need to make is that indeed we have looked at the resources that we have been using. It is in data that all resources put together, this country in the last financial year, we utilized close to 550 billion. If this money is put into good use, every facility will have enough healthcare workers, and also we'll have enough commodities. We will have a working system, which all of us are calling here, on what we call the information technology, which the right speaker was explaining. And I want to emphasize only one thing about this system, because it can easily help us make good progress in terms of managing the human resource, because you'll get to know where they are and where they are working. 2, it can also be able to tell us where we have the commodities, where they are not well utilized. If they are approaching probably expiry, you shift them to where they are needed without going to purchase others. And lastly, on that system, it will actually help us in terms of approving the claims that are made for purpose of pay, and it